I am Thelma Abu. I'm a University of Toronto Mississauga postdoctoral fellowship recipient. I'm in the Department of Geography, Geomatics, and Environment. My interest in this area started from my own lived experiences in Ghana, where I was born, raised, and had my earlier education. We know that our health and well-being is determined by the conditions in which we are born, we are raised, we work and play, as well as age. And when we talk about achieving global health equity, it's all about how everyone everywhere can attain their full potential when it comes to issues related to health and well-being. And no one is disadvantaged from achieving their potential or this potential because of any kind of social determined circumstances or their social position. So as I indicated, my interest in this area started with me trying to understand inequities in accessing safe water in Ghana. And we know that water is a basic necessity for life and a human right. And earlier on in my education and training in environmental science, and also volunteering with WaterAid Ghana in Ghana, I soon realized that we cannot talk about water insecurity without talking about the intersection of these key constructs, which are climate change, health, gender, development, as well as their links to policy, which are shaped by social and ecological factors and processes within places. Through my work on water insecurity in communities, it exposed me to the fact that there are challenges not only in the households, but also in healthcare facilities where infection prevention and control and safety is supposed to be optimum. And in 2018, there was a global call to action by the United Nations to ensure that access to safe water as it relates to water sanitation and hygiene is incorporated in implementing universal health coverage or globally. And various ministers of health and non-governmental organizations working in this sector came together to find ways to address this challenge. So later in 2018, Kenya began to pilot universal health coverage, and I was interested in understanding or exploring how best issues related to water sanitation and hygiene or access to safe water was incorporated into this pilot program. And the county where I worked in, which is the Kisumu County, was one of the 4 counties that was incorporated into this was one of the 4 counties where this universal health coverage was piloted. And this was because of the high levels of communicable and infectious diseases in this county. And as part of this work, I got to understand the institutional challenges which are deeply rooted in power and politics, as well as ecological challenges as it relates to climate change and variability, as well as disease outbreaks, and how these work together or how these intersect to shape access to water, sanitation, and hygiene in these healthcare facilities. So with all these in mind, I also work with research placement partners. And my research placement partner for this work that I did is Kohizu, Community Health Support, which is a local NGO in Kisumu, working in communities along the Lake Victoria. And working with these partners is very influential when it comes to them integrating findings from my work into their research, into their agenda, and also being able to have evidence to advocate for the necessary resources that these facilities need in order to provide safe services to patients who come there seeking care. And overall, I also think that beyond working with partners, community partners or research placement partners, making my work visible in various ways through peer-reviewed literature and also grey literature draws attention to some of the basic services that we lack in various communities or in the communities that I work in. With this work, I am currently in the data collection phase, but overall, the pandemic is exposing a lot of structural inequalities in various places. And we know that the communities that I am working in which are the Black communities and also the racialized communities, were disproportionately impacted by the pandemic. So my team and we are interested in learning from the community in terms of their experiences and how best that can shape or how best that can strengthen community resilience and also inform future public health messaging and care that address their needs. As an early career scholar, most often we tend to work on research agenda or programs that our advisors or mentors work on. One thing I would say is that as graduate students or early career scholars, we should be able to incorporate research questions into our mentors' research programs that are of interest to us. And in that way, we are carving or creating that niche for ourselves as emerging scholars. Secondly, I will talk about the fact that we need to build our resume, or in terms of building our own capacity through engaging in other activities other than just our research work. For example, there are always teaching opportunities, and those are ways we get to learn more from others, especially students, our fellow students, and also engage in peer mentorship. I would say that I belong to a lab, which is the Geographies of Health in Place lab at the University of Waterloo, and sometimes our peers are much more critical as opposed to our mentors or our advisors. So it's very important to build that supportive environment as we grow and as we grow in our fields, so we can always fall back when we need that support and help during our career trajectory.